This is Eileen Fee from Transform Your Body Fitness. I'm a physical therapist and a fitness coach. So let me ask you, do you have shoulder pain? Do you have difficulty raising your arm up? Do you just, you sit there and you have pain, let alone moving it and you have pain? Shoulder pain can come from a lot of different reasons. Sometimes simply that you're sleeping on your shoulder and just repetitively over years, you jam up your shoulder joint. It could be due to bursitis, tendinitis, rotator cuff problems, even just working out and you're working your shoulders, which are all good things, but they tighten everything up. And what happens, your shoulder joint is what they call a ball and socket joint. So if this is the portion of the shoulder blade, and there's like a cup called the glenoid fossa, and this is the head of the humerus, which is the upper part of the arm, and they're supposed to fit together nicely, but there's a space that's supposed to be there, and that allows for the movement of all the things we can do with the shoulder. But what happens is that through time, through scar tissue, through injuries, through a lot of different reasons, it jams together. And instead of that space being there, it jams together. And first of all, it causes pain. Secondly, it will limit your range of motion. So one of the best and easiest tips that I can give you is pendulum exercises. Some people may have heard of them, some people may do them, but a lot of times I've seen people do them incorrectly. So let's show you the correct way of doing it. You lean over. Now, for my purposes, I'm just leaning on my leg. It's actually better like if you leaned on something to allow your other arm to dangle. So if you did like your arm on the countertop or a chair, but for now I'm just leaning on my leg. The point is that you let the painful shoulder just dangle. This is what they call a pendulum exercise. And you're basically letting gravity move it. Now what I've seen incorrectly, this is what people will do. They do all kinds of things. That is actually going to cause everything to tighten. Instead of helping to create that space to relieve the pain and decompress everything, by doing all of that, it's going to be like a counterproductive movement. What you're trying to do, just let it dangle. Now you can go forward and back. There's different ways, directions you can do it, side to side, but it's a very small movement as compared to all this stuff. Now, if you're looking to decompress it further, you can actually use a hand weight, and that will help open it up and pull it down. And again, let me see if I can, you're just trying to open and decompress that shoulder joint, all right? Versus, you're seeing all this kind of stuff. Don't do that. It's a simple type of a technique, and it's meant to open up and decompress. What I was just showing you, the problem of the pain and the decreased range of motion is everything is jammed. But if you're doing all that crazy movement, you're actually making it worse. Let the gravity pull it down, open up that shoulder joint. That is going to give you tremendous pain relief. It's simple, but it's effective. So this is your pro tip for today. Take me up on my tip. Hope it helps. It's about staying as healthy as you can for as long as you can. Stay tuned. There's more tips to come. Have a great day, everybody.